Hi guys, welcome to Drug Detectives YouTube channel. My name is Dr. Bosnak and welcome. Alright, let's start through this. We have a patient with type 2 diabetes and some heart risk factors, high blood pressure and high LDL cholesterol. His A1C is still too high and his LDL is above goal, so we need to adjust his therapy. Option B, increase metformin dose. This sounds tempting, but he's already on a max dose of metformin. Upping it any further won't really improve his glucose control in a meaningful way, so this option is out. Option C, add hydrochlorothiazide. This would help lower his blood pressure, but here's the thing. His blood sugar and cholesterol are still major concerns. Managing those needs to be the priority. So while hydrochlorothiazide might make sense later, it's not the most urgent change he needs right now. Option D, switch atorvastatin to simvastatin. Swapping statins here won't do much. Simvastatin and atorvastatin are both statins, but atorvastatin is more potent and better at lowering LDL, so there's no reason to make that switch. Definitely not our answer. That leaves us with option A. Add a GLP-1 receptor agonist. These drugs lower blood sugar and reduce cardiovascular risk, which is exactly what this patient needs. It's like hitting two birds with one stone. So the most important thing to remember here, for patients with both type 2 diabetes and heart issues, adding drugs like GLP-1 receptor agonists is a great way to control their blood sugar and protect their heart at the same time. And just so you know, NAPLEX loves asking questions about drugs with multiple benefits, especially in patients with multiple conditions. So whenever you see someone with diabetes and cardiovascular risk, think GLP-1 or SGLT2 inhibitors. Alright, second question. Warfarin is always a tricky one because it has so many interactions. Let's go through these options. Option A, acetaminophen. Acetaminophen can increase the INR a little if taken in large doses for long periods, but is usually safe in occasional or moderate doses, so this isn't the main concern here. Option B, metoprolol. Metoprolol is used for heart rate control, but it doesn't interact with warfarin in a way that would raise INR or cause a bleeding risk, so we can rule this one out. Option D, lisinopril. This is used for blood pressure, but again, no interaction with warfarin that would make bleeding more likely. Option C, amiodarone. Bingo! This one's the culprit. Amiodarone significantly increases warfarin levels, and you'll need to monitor the INR closely or reduce the warfarin dose. Anytime a patient is on both warfarin and amiodarone, bleeding risk goes up, so you need to stay vigilant. So, takeaway here, amiodarone and warfarin are a dangerous combo. Always keep an eye on the INR and adjust warfarin doses accordingly. And here's a quick pro tip for NAPLEX. When you see a question about warfarin interactions, look out for drugs that can increase INR, especially the FAB5, fluconazole, amiodarone, Bactrim, TMP, SMX, F-fluoroquinolones, and F-flagyl metronidazole. These are high-yield topics, so make sure you're comfortable with them. So this one is about patient education, a really common NAPLEX topic. Let's go through the options. Option A, take your inhaler only when symptoms occur. This is a big no-no. Inhaled corticosteroids are meant for daily use to prevent asthma symptoms. They reduce inflammation in the lungs over time. You don't just use them when you feel short of breath. That's what a rescue inhaler like albuterol is for. Option C, use your corticosteroid inhaler before your rescue inhaler. Actually, this is backward. The rescue inhaler comes first to open up your airways. Then the corticosteroid inhaler can work more effectively. If you use the corticosteroid first, it might not reach deep enough into the lungs to do its job. Option D, store your inhaler in the refrigerator to keep it effective. Nope, no need for that. Inhalers should be stored at room temperature. Sticking them in the fridge won't make them work better. That leaves option B. Rinse your mouth after each use of the inhaler. This is super important because inhaled corticosteroids can cause oral thrush, fungal infection in the mouth. So, always remind patients to rinse and spit after each use. Simple but crucial advice. And just so you know, asthma and COPD counseling are frequent NAPLEX topics, especially around inhaler technique. The key thing to remember here is that rinsing helps prevent side effects like thrush. And here's a fun way to remember it. After you puff, swish and spit to keep your mouth clean. Alright, we came to the end. Before saying bye-bye, please follow our channel and write your comments. See you next.